thank you very much and good afternoon, and thank you very much, Professor McCarran, for the invite to speak today at the Science of Happiness Week. I'm going to talk over the next half an hour about smiling and the importance of smiling in health from very much a dentist perspective. So what am I going to talk about today? I'm going to talk about smiling in general, why we smile, why we do it, how we use it. I'll talk a little bit about the psychology of smiling, but I know that will be covered by the keynote speaker tomorrow night. I'm going to talk about the need for teeth, particularly in modern society, how important teeth are for us and how we relate to other people. Then there'll be a quiz in what we notice about other people's teeth and how we notice changes in other people's dentition. And the last thing I'll address is how much are our teeth worth. There's been a lot of debate over the years as to, is it harder to smile than to frown? And it was always thought that it took about 25 muscles to smile and only about 3 to frown. The muscles of the face are particularly complicated, but the latest thought is that it takes about 1 more muscle to smile than to frown. So hopefully that will lead to more smiling in time. So why do we smile? Where do we start with the smiling? We often smile to give a good first impression, and an awful lot of smiling is very superficial when we meet people first, when we talk to them first. This is President Obama. He's trying to say to somebody, you can trust me, I'm not a threat to you, I'm someone you can engage with, as opposed to the guy standing over his right shoulder who doesn't look as accommodating. We also smile to get people to trust us. When we meet them, we try to break down barriers and establish a relationship between us and the person we're talking to get them to believe what we say is true, and hopefully in this man's instance, sell a second-hand car while he's at it. If you're guilty, the secret is smile. The more guilty you are, the more you should smile. It's been shown that if you've been caught committing a criminal act and you smile, you are less likely to get a longer sentence, both by the lawmakers and the judiciary. So maybe this man has quite a reason to smile at this stage. But smiling gets you out of trouble. Also, when you're engaging in conversation with somebody, you can make somebody feel better by smiling back at them. The man wearing the blue t-shirt here is smiling back at somebody who's talking to him and offering positive reinforcement back to that person. That makes both the person speaking to them and that person feel better, particularly for females. This doesn't seem to apply as much for males. I don't think many of us like to be speaking to an audience that would look something like that because there's no feedback coming back. And thankfully there's nobody yawning here today, so that's great. We do it for attractiveness, to be attractive to the opposite sex. But there's a huge difference here between males and females. And the one rule does not apply. If you are a male and you smile at a female across a bar, and this is from Walsh's study, and she doesn't smile back at you, the chances of you engaging in conversation with that girl are about 20%. If, however, you smile at that girl and she gives you a big beaming smile back, you're 60% likely to talk to that girl. So you treble your chances by smiling back. The opposite occurs for men. You have no chance. Title of the paper, Happy Guys Finish Last. If a girl smiles at you across a bar and you're a fella and you smile back, you might as well go home at that stage. You have no chance. Absolute rejection. And it's been shown that women much prefer the brooder, more broody, sultry, even slightly grumpy male. And that's why he explains the success of certain groups in the past who would always have had a grumpy approach. There is some scientific evidence too that smiling makes you live longer. This is a rather tongue-in-cheek study which looked at the baseball register between the years 1900 and 1950. And every player in the baseball register has a picture. And they looked at whether that person was smiling at the time, whether they had a part smile, or whether they were looking grumpy. And they found out that if you had no smile, you lived on average about 73 years. Whereas if you had a smile, you lived to be nearly 80. So it's been shown that smiling does improve your longevity. The same group also looked at divorce among married couples by looking at their wedding photos. And there's a direct analysis between the number of people smiling in the wedding photo and the rate of divorce. But I'll leave you look at your own wedding photo to see that. We can also hide a lot of what we do by smiling. You can conceal your thoughts. And this poor girl I've picked out is an absolutely false smile. And this is a smile where I come from that say that only reaches the mouth but never the eyes. And what this person is trying to do is trying to give a sense of being happy, but if you look at her eyes and her furrowed brow, she's actually more frightened, but trying to give a positive impression. So this is a false smile, and I'll teach you in a few minutes how to recognize a real smile from a false smile, because it's very important, because if you can spot somebody who's giving you a false smile, it gives you a distinct advantage when dealing with that person. Not everybody smiles for fun. It used to be that, showing your teeth was a sign of aggression. Maybe it still is in a certain way. I'm not going to deal in any great length with the psychology of smiling, but attractive faces and smiles do actually make a difference at a biochemical level. And it's been shown that if female subjects look at pictures of either females or males who are attractive, of high attractiveness or low attractiveness, you get a very marked activation of a part of the brain which is involved in the stimulus reward. So whether you're a female subject looking at females or males, if the person is smiling and more attractive, there's a much higher activation. And the same counts for males as well. There's also a little bit, as we said earlier, with the earlier speakers, Helen said about serotonin, which is used as a medication in treatment of depression in some cases, but that we know that smiling alone can release neuropeptides, and it also has a contagious effect. Somebody smiles at you, you are 70% more likely to smile back at them as a starting gesture. So there has to be one or two pictures. I am a dentist. I got to bring these everywhere with me. So why do we need teeth? And teeth, particularly in Western society, play a very large part in how we perceive other people, particularly in the area of first impressions. It gives a good positive first impression if somebody has a nice smile and a good set of teeth. Most people wouldn't like to see that coming at them at any stage. Just to show, this is a girl called Rosario Dawson, who's a very famous A-lister. And again, a lot of her smile is based on her teeth. And a lot of the Hollywood smile, the Hollywood actress, is all based on teeth. She doesn't look so pretty now. She's gone from being a very attractive late 20s, early 30s to somebody who's a lot more aged and probably a lot less attractive, putting it politely. And the same happens in males as well as females. It produces a very marked aging effect in people. So just something as small as moving your teeth, or removing them in this case, produces a large variation in people and how we see people. There are also males in our society who've made a career out of having bad teeth and are synonymous with crooked smiles. I'll come back again to smiling, but this is an example. This is somebody called Blake Lively. I'm not good on the Hollywood gossip bit, but these are two examples of completely false smiles, and I'm sorry to have to pick out the one person twice. I explained earlier the one on the left, the furrowed brow, the eyes, the smile not reaching the eyes. The one on the far side is the classic, what's called the Hollywood jaw drop smile. It's an absolutely simulated smile, and to project yourself as smiling, you open your mouth very widely to display your upper teeth, but this isn't a smile at all. It's a very false attempt at a smile. So what is a true smile? And it doesn't involve chopsticks, the first part. It's thought that the middle is seen as a small smile, standard smile, and they're using chopsticks between the teeth just to hold that expression. What you see in this is the mouth is widened, the cheeks haven't changed shapes, and the eyes have closed very slightly. The absolute classic smile is described as being the Duchenne smile over here, and there's 4 components to it. There's a big wide smile here, the cheeks are puckered up on both sides, there are small crow's feet, although not entirely evident in someone this young, and also the eyes closed slightly. They are the 4 classic signs of a true smile, and I'll go through in a minute some of the false smiles that go with that. But they are thought to be the true sign of happiness, and if you're negotiating or in business with people, that is the sign that somebody is genuinely smiling back at you. So the question was, who was Duchenne? Duchenne was a French neuroscientist who got something by the ethics committee in those days. I don't think it go by in current days. He placed electrical probes inside the facial muscles of all his volunteers and passed a current through it. And what he was trying to do was simulate expressions. And what his work did, although quite strange by current standards, is that he said that flexing certain muscles produced very recognizable emotions. And for no great reason, this was his subject called the old man, and this was his shocked face as an electrical current is being passed through his forehead. So that's where the Duchenne part comes out of the smile. These are harder to interpret at this stage, and this is where things like emotional intelligence play a large role in how we interpret smiles. This is the genuine smile. These are both false smiles. There are very subtle differences between them. This has the standard 4 features of the Duchenne smile. The smile down here, puckered cheeks, crow's feet, and the eyes are closed slightly, just slightly narrowed. This is a false smile. This again is a smile here, but cheeks aren't raised, no crow's feet, and the eyes haven't closed. So this is a smile that's a false smile that is just restricted to the bottom third of the mouth. And this is what they call the conniving smile, where there is a slightly evil-looking intent, but he's got a smile at the lower here. There's no puckering of the cheeks, no crow's feet. But what this is there's contraction around the side of the nose to try and make it look like this is a sincere smile. But this is the only one that psychologists tell us have any role in true smiling. That would be seen as the classic true smile. In modern society as well, we can identify a lot of people by their smiles. We see them on every magazine, every newspaper. We see them all the time. So we can guess people by just seeing a very small portion of their body. So who's that? 10 out of 10. The hard one? Well done. Whoever said Anne Hathaway gets 10 out of 10. That's brilliant. So even by showing that small little portion of somebody's body, you can immediately identify with them. And it just shows how in modern society we judge people a lot by their smile and their dentition. And we can also suffer for it as well. So why am I concerned about smiling? What as a dentist makes me particularly concerned about this group? I work with a group of, a team in the dental hospital, and a group of people that have developmental anomalies of their teeth. That means they're born with structural problems with their teeth. And the two biggest ones I deal with are hypodontia, where people are born with a very reduced number of teeth, anything from missing 20 to 25 teeth. It is a large range, and they're born in that condition. Or else people who have deficiencies of their enamel or of their dentine, where the enamel comes through and breaks off and flakes off, or the teeth just crumble as soon as they erupt. This patient is about 15 years of age, this patient is about 20 years of age. So this impacts people at a very young age and is with them throughout life. What we noticed with treating these patients is that there was a large incidence of unhappiness. When you go back to smiling, we felt a lot of these people weren't very happy with their lot. And we questioned whether a number of them had issues related to their teeth, which was pretty obvious. So we followed that on a little bit, and together with Atef Hashim, who was a PhD student, Brian O'Connell, myself and Alan Kelly, we looked at these people with an initial study of quality of life. And we found that when you looked at these population and you actually compare them to patients attending the dental hospital for routine dental treatment, they had very marked reductions on their oral health related quality of life. It was so serious, particularly in the amelogenesis ones, which where the enamel is discoloured, that it actually became classified as a handicap, which is the most severe limitation you can get in quality of life. So for that reason, we have an interest in following these patients and trying to actually restore smiles to them, not just of a functioning dentition, but to give them the smile that they see at Hollywood and all the other areas. So this would be a 20-year-old girl, comes for a presentation, has multiple retained primary teeth or baby teeth, has multiple caries, has lots of interventions but got nowhere. And thanks to modern dentistry, particularly with the advent of things like dental implants, where we can put actually titanium screws into the jawbone of either the upper or lower jaw and attach prosthesis onto that without having the patient taking them in and out at night like the denture, we can restore their smile and their function over time. And that's her when she's actually 30. Similarly, for other people, this gentleman has 6 teeth in the upper arch and 12 teeth in the lower, and he'd been through an extensive amount of treatment before he'd seen us. And, presenting complaints pretty obvious. When I smile, I look goofy. People are always slagging me about my teeth, and I feel very marginalised and I feel upset about it. It takes a lot of treatment, but with a lot of things like the implants that we have, the ceramics, the metal substructures we have, we can restore him to this so he can reintegrate back into society and feel a lot happier about how he is himself. There's another gentleman, the last of the hypodontias. Again, he has 6 natural teeth in total. The rest of them are all primary teeth. And he comes to us and, he's having difficulty at school, he's getting teased, he's getting, life is pretty difficult. And after a substantial amount of rehabilitation, again using implants, he could be restored. And he's now restored about 12 or 13 years at this stage. So it can produce a marked difference. So we don't just restore teeth, we're trying to restore confidence back to people and their own self-esteem as well. This is a very mild example of amelogenesis imperfecta, where all the enamel on this young girl's teeth has either broken away or become discoloured. And you can see on her back teeth there is no enamel at all. It is all just broken off because the force of chewing food over time has just taken that away from her. But with using the team that we have between the orthodontist, the periodontist, oral surgeons, we can restore people like that over quite a long treatment time back to a normal dentition and a normal smile to make them more confident in what they do. Then, how good are we at spotting problems in other people's teeth? How much do we notice when we look at other people? In general, most of the dental studies have looked, and over the last couple of years, looked at what do we notice about other people's teeth and what do we see? What stands out in our eyes? And there are about 3 or 4 classic studies, but this is just one to start, just saying how fickle we are when we look at people when we smile. This picture of 2 volunteers, normal teeth, normal smile. These are the same volunteers up here, and the teeth have been artificially whitened using Photoshop. And down on the bottom here, the teeth have been artificially darkened and chipped to simulate decay and neglected teeth. And 180 female patients were asked about these and what they thought their psychological characteristics were and stories about them, and asked questions about them in terms of relationship. The scores here are for whitened teeth, original teeth, and the decayed ones at the bottom. So asked how socially competent they think this person would be, they get a 9.8 out of 10. How socially competent this person would be, 5.7. So the only factor you've changed anywhere in this person's life is their teeth. Intellectual ability, white teeth, 9.5 out of 10. Dark teeth, 4.3. So just by changing somebody's teeth, you have their IQ. If we could whiten teeth and double the IQ, we'd be doing better. Psychological adjustment, 9.1, 6.6. Relationship status, how likely would you be to enter into a relationship with a male or a female here? Top, 9.1 out of 10. Bottom, 5. So you've halved your chances. So as well as not smiling in the bars, get your teeth whitened. But it just shows how fickle we are, that something as small as that could be noticed and have such a large impact as to how other people view us. When we look at changes, we try as dentists always make change symmetrically, and this is a little quiz to see how observant you all are. There is a change starting here on this photo, and there's a 0.5 millimeter change here, 1 millimeter, 1.5 and 2, and there is a standard change. And this has been shown to people in many studies where they've been asked to see which one is different, at which one do you notice a change. And for most members of the general population, we're not very observant. What's happened here is the 2 front teeth have been shortened by 0.5 millimeter each time. And we have to shorten our front teeth, which are normally about 12 millimeters long, by 2 millimeters before anybody notices. So we can get away quite a lot with symmetrical changes. Similarly, there are changes here, 1 millimeter, 2, 3, 4. I won't go through these or ask anybody to go through, but what it is here is the second tooth in the line is being made narrow progressively as it goes along. Where would you have noticed that? Where would you have seen it? You can be honest with yourself, you don't need to give the answer. But the answer is that most people in the general population really don't notice until you're pretty much at the bottom. And you've taken 4 millimeters off a tooth that's normally only 6.5 millimeters wide. So you've practically decimated the tooth. But the key I'm trying to get across is because it's symmetrical, you can play a lot of tricks on patients and they don't notice it. Again here, changes of 1 millimeter, 2. Here it's the incisal angulation. Instead of coming straight down, we're making a slight angle on those. And that's something we thought people would pick up very quickly. And it is a lot quicker than some of the other tests you've seen. This is the Tom Cruise one, which might give it away. There's a 1 millimeter, 2 millimeter, 3 millimeter, 4 millimeter variation here. And what you're looking at is the gap between the 2 front teeth called the midline, moving that progressively over to the left-hand side, so the right-hand side as you're looking at it. So moving it 1 millimeter over, 2 millimeters over, 3 and 4. And the answer is, how far before anybody notices? And the answer is a long, long way. They reckon Tom Cruise's midline shift was about 5 millimeters, and it certainly didn't interfere with his career, as I'll show you later. And then this is changing the angulation of the front teeth, where the teeth are higher on the right and lower on the left. And people do seem to spot that at a reasonably early stage. And then the last one is substantial change over 6 millimeters from here to here, and it's the amount of gum that you show over the front teeth. This is the so-called gummy smile. And this has gone from where there's 2 millimeters of the lip covering the tooth to 4 millimeters, 6 millimeters being exposed. But again, in the general population, it's a long way down before anybody notices any change. Asymmetrical changes we're a lot better at finding, and we do spot them a lot quicker. Same hat, go look at these. There are changes all the way along here. And you can see that this tooth has been made shorter progressively all the way along. And people have spotted it at a very early stage. They spotted it at about 1 millimeter when it was asymmetrical, whereas they spot it when it's about 2 to 2.5 when it's symmetrical. So I'll make all the changes you can symmetrically. Again, this is a tooth here which is getting narrower and narrower. And we saw that when we did it symmetrically, you could get a lot of change out of it before anybody noticed, but here it was spotted fairly quickly. And the two last ones, again, are narrowing and shortening of the second tooth here, and that's picked up fairly quickly. The last one is interesting in that a lot of people have gaps between their front teeth, and the gap was progressively widened. It's called a median diastema in dentistry, and that has been widened, and people were asked at which stage did they notice it, and the answer is they never really noticed it until it was greater than 2 millimeters. So there are some things we notice about teeth and some things we don't. So in general, when we talk to dentists, we say that if you're going to make any alterations to people's teeth, always make them symmetrically. That way it improves the smile and makes it less noticeable when they're talking to other people, and other people don't pick out difficulties as easily. If you're going to make an asymmetric alteration, you need to be very careful, because you'll probably end up with a patient who's not happy, even at the end of his treatment, as well as you can do it, because it's not symmetrical. How much are our teeth worth to us? It's the great question in modern society, and unfortunately nobody's ever thought to look at it. There are no real healthcare analysis to date on the cost benefit. There have been one or two done on replacing posterior teeth and the benefits for chewing and function, but never on the social aspect of having teeth and a good smile. It seems to be highly individual, and the entertainment industry, and particularly in Hollywood, and the social media have a significant influence on how we perceive other people. He had to come into it somewhere. This is Tom Cruise for most of his young acting career, and the midline of his face went straight through an incisor, and all his teeth were shifted to one side quite markedly. And in the last few years, he's undergone significant reconstruction to restore. Like most people would say, that probably isn't too bad as a starting, but it wasn't enough for Hollywood society, and I think he was more or less coerced into having the treatment done to increase his longevity as an actor. There are also ones closer to home. This is Cheryl Cole before she went on X Factor. This is just her after X Factor, and she's had some very nice work done to change how her appearance goes. This is Nicolas Cage, again, before and after. Some doubts a little bit about the after, but this is what's seen to actually be important in society, and that the smile is worth so much that intervention is needed in a lot of cases, even when there's only very minor irregularities, to make you, an A-lister type of individual. This is a man called Bjorn Klinge, who is probably one of the most eminent dental researchers in the area of implantology in the world. And in a recent interview, he was saying that the teeth and the smile are so important that we're often looking at millimeters and small areas, but restoring somebody's smile produces a huge benefit to them. And as a trick, and sometimes in the past, he had made a little denture that went out over his own teeth, and he went and smiled to people, and he said he felt that in one small move, he had moved himself from being an eminent professor in an eminent university to being somebody very much on the fringes and margins of society by just one change. I don't agree. I think he changed his hair colour as well, but we won't work on that. So I hope over the last while I've given you a brief introduction to smiling, dental aspects of it, why it's so important, how we look on smiling, and what a genuine smile is versus a non-genuine smiling. And I think the message that goes through all the speakers we've heard today is, can you spare a smile? Any smile helps. But I would add to this and say it has to be a real smile, now that you know what a real smile looks like. Thank you very much.
Thank you. I just want to say a sincere thank you to Michael. I think that was absolutely wonderful presentation, and we can all take confidence in that, Michael. So you have.